I welcome you all. Poll security and what's this going on? Breakout rooms, reactions, chat, polls, participants. So we are going to the live. Good. Good afternoon to everyone. Good afternoon to everyone. So welcome you all for today's webinar, free webinar on the Ayurvedic pulse technique. So if you have any questions, you can put it on the chat box. We'll be happy to answer for your questions. This will be a 1 hour session, recorded session. And we are going to give the nutshell of the information about the pulse analysis and pulse technique, Ayurvedic pulse technique. So welcome you all for this special event, which we are doing today. We are expected to have 100 people in this webinar. So as you know that a lot of people are aware about this pulse analysis. This is an ancient system of art of healing from the Vedic sciences, and also in Western science, Western medicine, as well as in the acupuncture, as the Chinese system of medicine, other systems of medicine also adopt this technique. So here we are specifically explaining that how the Ayurvedic pulse technique differs from the other systems of the pulse technique. Ultimately, everybody is saying the same location. The pulse is the same. But we look into it differently, how Ayurveda looks into that. For this, the ancient rishis, Charaka, Shushita, Vagbhata, various acharyas, scholars, has explained the pulse technique. And that is called, in Ayurveda, is called Nadi Vignan. Nadi means pulse. Vignan means knowledge, a science of art of pulse reading, a pulse technique, pulse diagnosis, pulse analysis, which we are calling as here pulse technique. A technology, we are going to use it here. For this, you can use the instruments, like a Western medicine uses the instruments such as ECG, EKG, and all the levels, and pulse analysis, pulsometers. And as well as, we also see various aspects of the pulse with the new technology like a Veda pulse, Nadi Tarangini pulse analysis, whereas a manual technique like what we are feeling into the pulse in our hands. For this, you need to have a precise, a concise understanding of the Ayurvedic philosophy, understanding of the knowledge of the Ayurveda, how it can tell. Ayurveda can bring the the holistic approach of the health and wellness. In this 1 hour session, we are going to discuss various aspects. I am going to give the overall information about the pulse technique. So now I'm going to share with you my screen. I'm going to share with you screen. Now I'm going to share with you somebody's screen. Hello. I'm going to share with you screen. Now I'm going to share with you somebody's screen. Hello. I'm going to share with you screen. Now I'm going to share with you. Okay. Hello. I'm going to share with you screen. Now I'm going to share with you. Okay. What's happening? I'm going to share with you screen. I'm going to share with you. Hello. Everybody mute themselves. Please mute yourself. Hello. Everybody mute themselves. Please mute yourself. Hello. Everybody mute themselves. Please mute yourself. Hello. Everybody mute themselves. What's going on here? What's going on here? What's going on here? Hello? Okay. Yeah, somebody having some problem with the muting. Sorry for the disturbance, and please unmute yourself. Everybody mute yourself. Don't disturb the flow. And if you have any questions, I will be happy to answer for all your questions. Please write in the chat box. Don't unmute yourself, and it will be very good. Session will be there here. And great. Myself, Dr. Shekhar Annambhotla, BAMS, MD Ayurveda, LMT, licensed massage therapist and registered Ayurvedic doctor, and also various credentials I have it. I am practicing Ayurveda and more than 33 years teaching around the globe, educating the people, various aspects of the health. Sorry, something is going on here. So today, just I am going to chant with a Dhanvantari Stotram. So you can chant yourself inside, but don't loudly say, and you can say loudly also, no problem, because you are muted. Om Namami Dhanvantari Madidevam Sura Surair Vandita Pada Padmam Loke Jararubhaya Mrutyunasham Dataramesham Vividaushadina. I bow and humbly request Lord Dhanvantari, who is the embodiment of perfect health, respected by the great seers and evil people, to remove the old age, disease, fear, and death through his divine presence in all natural herbal medicines. Now, Goddess Dhanvantari, blessings are required for us all the time to learn the education part. So we are embarking our studies with the blessing from the Lord Saraswati, Goddess Saraswati. Saraswati Namastubhyam Varade Kamarupini Vidyarambham Parishyami Siddhir Bhavatu Manasa. I offer deepest respect and great reverence to Divine Mother Saraswati, who fulfills my desires and provides perfection in my education. Ayurvedic pulse technique. As you know that we have to see the pulse, which is called radial pulse, radial artery pulse. So we have veins and arteries are there. We always look into the radial pulse. So who can join in this program? Who can learn this program? All the healthcare professionals. Any healthcare professional who is practicing Reiki, yoga teachers, massage therapists, and medical doctors, health professionals, anybody seeking for the alternative health way of looking for the pulse analysis that are eligible to do, they can immediately implement into this their practice. Because the reason is that they are able to see the lot of patients or clients, students, they can able to differentiate the pulse easily. Yoga practitioners and Chinese medicine practitioners, acupuncturists, massage therapists, anyone who is interested in the holistic natural healing for himself, his or her own wellness. This is also very important that any general public also can learn. More than 15,000 people we have trained in Ayurvedic pulse analysis, various countries, more than 30 countries. And the participants will learn in this program, develop. So this is called, I came up with an acronym, is called develop, detect, eliminate, verify, evaluate, locate, observe, and predict. Detect ongoing physiological changes and imbalances in the surface and deep levels of the pulse. So what is going on in our pulse? How the pulse is there? What is going on? We have a lot of emotions are going on, physical, emotional, spiritual, all the levels, environmental, every factor can influence our health and wellness. So detecting the pulse in the early stages. Eliminate toxins. Toxins can be eliminated, enhancing the digestion, achieving the optimum health. By knowing about that, if you have some issues are there in our physiology, that can be rectified by proper elimination procedures. Verify the levels of ama, toxins in the body, or endotoxins in the body. Prana, vital energy. Tejas, vital force. Tejas, vital energy, and prana is vital force, and ojas is a vital immunity, and sattva, rajas, tamo, gunas, and everything we can learn through the pulse. Evaluate the imbalances of Agni, the digestive fire, metabolic fire in the body, how the Agni levels are there. Agni, Tejo, Dhatu, Nam. So Agni is the one of the important factor for maintenance of health. So in Bhagavad Gita mentioned that Aham Vaishvanaro Bhutva Praninam Deham Ashrita. When the Krishna, Arjuna asks Krishna, where are you? Who are you? How can I feel? How can I identify you? I am the supreme in the nature, and I am in the form of Agni or Vaishvanara in all living creatures. Locate and feel the subdoshas of the pulse. Various levels of the pulse, subdoshas are there. So we will discuss all the various subdoshas also. Observe, understand organs and tissues in the pulse, organs and dhatus in the pulse, and organ pulses also we can know. Predict influence of circadian cycles on the pulse. For example, in the daytime we have predominance of early morning, predominance of kapha dosha is there. How the kapha dosha influence on the body, and how the pitta dosha influence in the body in the daytime, and in the evening, and kapha vata dosha, how the doshas are influence on your health and wellness. So benefits of the pulse reading: detection of the imbalances at the early stage, detecting the cause of the imbalances, restoring the balance by proper administration of herbs, diet, lifestyle, and seasonal routine, yogic postures and breathing exercises, meditation techniques, natural physiological cleansing processes like a detoxification programs like a panchakarma therapies. This program is 35 hours of program certification issued after the successful completion of the training, and of course we have an assignments has to be done. If you are, even though the course is very taught in a systematic way, we have put together a 21 hours. 7 levels are there. The 7 levels we are going to discuss. Each level we are going to discuss in 3 hours of webinars, which are recorded, and this is available. And with this training program, and you have to do homework. Once you have done this homework, you will be getting a 35 hours of certification from the approved by the APNA, Association of Ayurvedic Professionals of North America, and is a best continuous professional Ayurvedic continuing education pays credits. You will get it by doing this training program. You will be certified as a Pulse Ayurvedic Pulse technique. Pulse examination, which examination called Nadi Pariksha, is a knowledge of pertaining to the Nadi. Nadi here, there are, according to yogic philosophy, more than about 7,000 Nadis are there. But here we are going to talk about the radial pulse, which is the important pulse in the body. That is the thing, is going to assess the levels of the pulse analysis. The best time to feel the pulse in the early morning is the best time. As soon as you wake up, you can feel the pulse. Pulse can be influenced by the intake of food, exercise, sleep, hunger, thirst, anger, grief, worry, and all the physical and emotional, spiritual, all the aspects are connected to this pulse. The best place to feel the pulse is the radial pulse. This is the way where we look into the pulse and everything. How to feel the pulse? Is the Sharangadhara Samhita is classically textbooks mentioned about that. The Karasya Angusta Muleya Dhamani Devasakshini Tat Chestaya Sukham Dukkam Nyayam Kayasya Panditai. The pulse resides at the base of the thumb. Base of the thumb represent the life energy or force. A well-trained Ayurvedic physician, a scholar, which is called a scholar, Pandita, can identify its movement, knows all about the happiness and misery, balance and imbalances. Sukha, dukkha, which are considered as the happiness and misery, which are called in Ayurveda balance and imbalances. How can we detect imbalances on early stages? Though Ayurvedic pulse technique, imbalances can be detected before they manifest as a disease. So prevention is better than cure. Heyam dukkham anagatam. Avoid the danger before it comes. When you are feeling, for example, you are feeling headache is there. What type of headache? If it is a headache, is Vata headache, Pitta headache, Kapha headache. All headaches are different. So if you are dominant of Kapha dominance is there, that means you can immediately tell that you have a nasal congestions are there. So if you have Pitta predominance is there, you are having a pounding, tearing of the head and everything is happening. That is an excessive heat is also producing in your head. That is indicates that Pitta headache. Vata headache is a sharp needle pains are there when you have a predominance of the pulse showing of a Vata pulse. Vata finger is showing that. We will discuss that areas also there. If the imbalance is detected, acted upon and corrected at an early stage, successive stages can be prevented in health and disease. So in Ayurveda clearly mentioned there are 6 stages of manifestation of disease. Sanchayancha prakopancha prasaram sthana samshayam vikti bhedam jayo veti doshanam sambhavet bishak. So Sanchaya, Prakopa, Prasara, Sthana Samshaya, Vikti, Bheda, and all the different stages of the manifestation of diseases also there. So that means in the early stages, if you arrest them, and further disease can be manifestation it will not take place. Recovery at an early stage is easy. Prevention is better than cure. Everybody knows this point like that. Recovery in the early stage is easy, but when we are ignoring that part, then we are knowing about these things. Like think about that. When the rain is coming, be prepared for your umbrella. When the already rain started, you are become wet. Prepare yourself. That is the thing is very important. Ayurvedic pulse analysis will gives you a utmost important like that. That is the reason Ashtasthana Pariksha is clearly mentioned in Yoga Ratnakara. Nadi Mutram Malam Jihva Shabdasparsha Drugakriti. Out of all 8 examination techniques, one of the first primary important role is that pulse analysis is one of the techniques. How to detect cause of the imbalances? Pulse reading, pulse analysis allows one to detect the cause of the existing imbalances. This will allow treatment to correct the root cause of the problems and therefore most effective. So pulse analysis can give you a detailed information on how to detect imbalances in the early stages of imbalances. A technique is important like that. Like think about that. A guitar player and he doesn't know how to play the guitar. After taking some of the sessions, he is able to play beautiful songs. Similar way, a Ayurvedic practitioner, a practitioner, student, or anybody who is able to precise way that they are practicing, it will bring them perfection. So that is the thing is very important. But we cannot give up. In the early stages, it's very difficult. But later stage, once you are learning this technique and everything, we are here to teach you technique. That technique will be beneficial for you, and you can develop the mastery in that. How to restore the balance according to measurement theory in the physics. Attention enlivens the attention of the object. Ayurvedic pulse technique, once attention enlivens the own pulse, facilitating natural balancing mechanism in the body and helping to rectify any growing imbalances. So attention enlivens the object of attention. So when you are feeling your own pulse, then it is slowly changing over these things. For example, if you had a nasal congestion is there, because you need to have background knowledge of Ayurveda, and Ayurvedic principles are required. Ayurvedic fundamental principles are required. Without knowing about that, it cannot be standalone. Pulse analysis technique is not standalone technique. It has to be learned. Like when you are going to the master's program or doctoral program like that, you need to have basic anatomy, physiology, pathology, and everything. Similar way, a physician, if he is undergoing for the training program, and a person, surgeon who is going to become surgery, without that, he is not studying anatomy, physiology. Yes, he has to learn every step of the anatomy, physiology, pathology, and everything, what is going on, pathological changes, everything he has to know. Then only he is able to become a good surgeon. Similar way, Ayurvedic students who are undergoing with the Ayurvedic anatomy, physiology, pathology, and everything they have to understand, then only they can put them together. Ayurvedic pulse technique contributes directly restoring the balance and alleviating the disorders. That is the reason it will help you not only is contributing in restoring the balance and also alleviating the disorders by restoring of various techniques by using of herbs, marma chikitsas and mantra chikitsas, and as well as panchakarmas, and various methods are there, psychotherapies and everything there. You can work on that. Meditation. These are the special guidelines while you are feeling the pulse. For men, always feel in the right hand side, and for women, left hand side. You may ask this question, why we have to feel the right hand and left hand? Ida and Pingala nadis are there, Surya nadi and Chandra nadi, two nadis are there in the physiology. Right side is the Ida nadi and Pingala nadi in the opposite side. When the two nadis are there, Ida Pingala nadis, which are heating and cooling nadis are there. When the energy is more stronger in the right side of the men, and women, it's the left hand side is more. Special note, when you are feeling the organs pulse, one has to feel the both hands. When you are feeling the organs pulse, various parts of the body is there, because some of the parts of the organs are in the right side, some of the parts of the organs in the left side. So once you have to understand the both concepts of the both sides feeling the pulse. Special guidelines of feeling the pulse: nails should be short, very short. It should be short. It should not touch it. So that means when you are feeling the pulse, if you are feeling any of nail bites are there, nail prints are there on your skin, that indicates that you are not doing perfectly. Your nails are stronger. So you need to have, because the reason is that when you are feeling the pulse, various levels, 1, 2, 3, 4, 5, 6, 7 levels. The 7 layers are there. In the 7 layers, when you are feeling the pulse, then you are able to see the various levels of the pulse and everything. Sit in a comfortable position. You cannot feel the pulse anywhere in these things like that. You have to sit comfortably and relax yourself before starting the pulse. Similar way, like a blood pressure machine. When you are taking a blood pressure machine, you cannot stand up like that. You can be relaxing position. Then only you can see the permutations and combinations like that. That may fluctuate your the blood pressure levels also. Same way, applying the even pressure with Vata, Pitta, Kapha fingers are very, very important. That is the thing. That is the reason we are telling you here 3 fingers, which are identified as the index finger is Vata, middle finger is Pitta, and ring finger is Kapha. Identify correct location of the placement of the Vata, Pitta, Kapha in their location. It's very important that, as I mentioned to you, Karasya Angustam Muleya Dhamani Devasakshini Tachestaya Sukham Dukkam Nayam Kayasya Panditai. That means here Angusta means thumb, Mula means root, the base of the thumb, where the styloid process is there. Anatomically, the radius bone, where the styloid process is there. Below the styloid process, there is a groove-like structure is there, where you can feel the pulse. Everybody can feel the pulse. Feel the pulse yourself. You can feel the pulsation is there, and there the pulsation starts. That is the index point. That is the index point. Next to that, below that, there is a second finger. Then next to that, third finger. You can feel all 3 fingers in the pulse. Okay. Uneven pressure skews the correct point of the reference, leading to incorrect analysis. The intention of applying the pressure evenly enough to ensure the correct performance of the pulse and the technique. Because the reason is that very important that when you are feeling the pulse, you have to give the equal pressure. Equal pressure means all three fingers are equal. So these three fingers are 3 in 1, 1 in 3. 3 in 1, 1 in 3. That is, remember this point, the Vata, Pitta, Kapha are inseparable. They are all together, but they work also together into the one way like that. It works together. So activities. Suggested time to feel the pulse upon rising, before and after meals, exercise, driving, and while driving, no. Okay, while driving, if you are a passenger, you can do it, but while driving, no. Sleep. While you are sleeping, don't do it. Before sleeping and after sleeping. But while you are sleeping, don't do it. Okay. And while paying bills, if you are paying the bills, electricity bill comes, something like that, or some bills you are paying like that, or you are paying your daughter's or son's tuition fee. It's a huge amount. Under the various weather conditions, such as climatic conditions, like climatic conditions of the weather, snow and rainy and windy days and everything, winter, summer and everything. Caring for children, when you are caring children. And there are some special activities of the mind, and particularly when you are happiness, love, freedom, joy, laughter, fulfillment of desires, enthusiasm, compassion, contentment and bliss and exhilaration and enjoyment. These are the things are happening in your body. And sometimes you may have some of the problems are there: irritation, anger, sadness, boredom, fear. All the different aspects are there in your physiology also. That can be rectified also. So that means when your mind is full of with the happiness is there, misery is there, and sadness is there, and at the same time the blissful state is there, and at the same time disease is there and health is there. All together are there in the physiology. That you are the flavors of all the symptoms you can see in your physiology. A balanced person. How do we know what is the balanced person? In Basavarajiyam textbook mentioned that Suvyaktatvam Nirmalatvam Swasthana Stitirevacha Amandatvam Achanchalyam Sarvasam Shubhalakshanam. Suvyaktatvam. It's clearly expressed. The qualities are clearly expressed. Vata pulse should move like a snake. Pitta pulse move like a frog. Kapha pulse move like a swan. So these animals are explained like that. Vata pulse like a snake, a zigzag, irregular movement. Even the EKG machines also, you can see the zigzag pulsations are there. And in the Pitta pulse, like a sharp movement is there. And Kapha pulse, more soothing effect is there on the pulse. So, Suvyaktatvam, all the qualities should be balanced. Nirmalatvam, crystal clear. Whatever the things are feeling that you are here, clearing that, okay, this is the clear Vata pulsation. Even I can feel the qualities of the pulse of Vata is dryness. Tatta ruksho lagu sita kharsushmas chalo anilaha. Pittam sasneha tishnosnam lagu visram sarandravam. Like that, there are qualities are there in the pulse. That is also you will learn more and more qualities are there, how the quality of the persons are there. And Swasthana Stitirevacha, that should be in the own place. That means Vata is not moving to Pitta, or Pitta moving to Vata, or Kapha moving to Vata, or Pitta, Kapha, Vata is going to Kapha. All the locations are not having. Combination permutations are should not be happening. Amandatvam, vitality, energy, enthusiasm, happiness, all the radiant pulse is required, and chanchalyam, not moving anywhere like that, not fluctuating anything. Sarvasam subhalakshanam. If these 5 qualities are there, definitely you can see the difference of the in the balanced pulse. Learn 7 levels of the pulse. This is exactly what we are going to teach in these classes. And various levels of the pulse we are going to, the importance of the Ayurvedic pulse technique in the classical Ayurvedic description and references. So that is the first thing we are going to discuss in detailed class like that. And in addition to that, benefits of the Ayurvedic pulse technique. Benefits of the Ayurvedic pulse technique you are learning. And how to feel the pulse in a balanced, imbalanced state. In both levels you are going to learn. And clearly mentioned like that. What is the balanced pulse? What is the imbalanced pulse? Some of the important suggested times to feel the pulse. So we may give guidance for you. You may write there's a PDF files are there, downloadable files are there, the worksheets are there. We give the worksheets for you. You can start working on the worksheets, how you feel that. Then also some of the important suggestions, guidelines to feel the pulse correctly. That is also important, that how to feel perfectly pulse. Identify the doshic pulses, as the various dosha pulses, vata, pitta, kapha, how the body is reacting and everything, you can feel it like that. Identify the doshic levels, locating the different qualities of the doshas in the pulse. That is also important, as I mentioned to you earlier, that the ruksho lagosita karsushmasyano anilaha. So that means vata qualities of dryness, roughness, coldness, and non-stickiness. These are the various qualities are there. You can feel the pulse. And pitta is sticky, oily, and heated. All the qualities you can see, the pitta qualities are there. And kapha qualities are dullness, slow, methodical. All the pulse covered pulse is there. You can see the kapha pulse. Influence of biorhythms, which are called circadian rhythms, circadian biocycles or circadian rhythms or biorhythms are there, and how the clearly mentioned in Ayurveda like the vayoho ratribhutvanam deyanta madhyadiga kramat. That means in the various timings of the day, you have a fluctuation of doshas are there. That also we have to take into the consideration when you are feeling the pulse. Increase and decrease of the conditions also, and the seasonal influence. Particularly in the spring season, you will see the predominance of kapha dosha. When you are having a winter season, more vata dosha is dominant. When you have a summer season, more pitta dominance is there. Influence of this daily routine, how the influence is there. Identify the balanced and imbalanced pulse. What is a balanced pulse? Which I talked already that. So vyaktatvam, nirmalatvam, swasthana, stitirevacha, amandatvam, chanchalyam, sarvasam, shubhalakshanam. These are the specific qualities are there. And balanced and imbalanced state of the pulse also can be seen. Signs of dosha, balanced, increased, decreased qualities. Then you have to see a clear picture of that. What are the qualities of the pulse? How the qualities of the pulse are reacting to your body and everything, that also we'll discuss in these classes. And at the same time, doshik gati. The gati means movement. How the movement is there. When vata is going to pitta location, what qualities you are seeing? For example, if you are feeling vata is moving to pitta location, what happens? When the wind, vata is wind, pitta is the heat. Okay, when the wind is blowing on the fire, what happens? It's heated up. And you feel burning sensation in the feet, burning sensation in the body, burning sensation in the eyes, burning sensation in the skin. All the qualities are seen. Or pitta is going to vata. That is also severe. That is also seeing that in the things that your movements are and activities are more active with the pitta qualities are there. And kapha is moving to vata location. It is also dullness. The movement is a depression, anxiety, worry, and all these symptoms are coming when the kapha is dominant in these things. Sometimes even though a person is depressed, you have to see which dosha is involvement is there, how this dosha is influence is creating the problem. And there are subdoshas are there, as you know that there are subdoshas are, each dosha having 5 subdoshas. Prana, udana, samana, apana, vyana. There are the 5 subdoshas of vata. Prana, udana, samana, apana, vyana. There are 5 subdoshas. Next, coming to the pitta, subdoshas are pachaka, ranjaka, sadhaka, alochaka, bhrajaka. These are the 5 subdoshas. Pachaka, ranjaka, sadhaka, alochaka, bhrajaka. These are the 5 subdoshas are there. Again, kapha subdoshas are kledaka, avalambaka, bodaka, tarpaka, sleshaka. These are the 5 subdoshas of kapha are there. So then those qualities also you will be learning in the various levels of the pulse. And again, you are also learning the Prakriti, the Prakriti of the individual, the constitution, body constitution, the Prakriti of the individual. We are also knowing about the deeper level of the pulse. And at the same time, dhatus. Dhatus are the dhatus means tissues in the body. Those tissues are rasa, rakta, mamsa, medas, asti, majja, shukra, and artava. Rasa Rakta Mamsa Medas Asti Madhya Shukra Artava. Plasma, blood, muscles, bones, and bone marrow, and adipose tissue, and reproductive tissue, particularly females and males, Shukra and Artava. These are the qualities also we will learn. Where to feel the pulse also we will learn. And again, we also identify the various organs in the pulse. Organs in the pulse means we have classified the organs in the totally 9 into 9, 18 organs in the pulse. Sometimes there will not necessarily the organ, which is the circulation is considered organ. And spinal column, spinal cord is also considered organ. And the brain is divided into the two parts, right hemisphere and the left hemisphere, and both things are also identified. And right kidney, left kidney. And liver, only one liver, no right liver, left liver, okay? Liver, spleen, gallbladder is only one, and uterus, prostatic gland, and various lungs. So all the areas we are able to identify them in a pulse clearly, that what is the imbalance is going on. And in addition to that, is also we are going to learn subtle levels of energies, like a psychological energies like a sattva, rajas, tamo gunas, as well as prana, tejas, ojas, and all the qualities also we are able to learn where to feel the pulse and everything explained. Understand the holistic approach of health and everything, and understand the deeper understanding of the body, mind, spirit, how to connect with your body, mind, spirit. This is the whole evaluation is done in the precise way, systematic way, in organized manner. It has shown very clearly that 7 levels of the pulse, which has shown very clearly. You are most welcome to purchase these webinars. Are already recorded webinars are available. It's readily available. You can go anytime. You can buy anytime. This is the link. You can go there. You can click on this link. So if I click on this link directly, cannot open these things. Okay, but you can go onto the website and Global Ayurveda Academy or Global Ayurveda Academy or Study Ayurveda. If you go to the website, there you can see, you can purchase this whole sessions with including the $275 in Indian currency, 19,995 rupees. You can buy it. How to help you at? If you need any questions, if you have any questions or purchasing any problem like that, please contact us by email. We'll be happy to support you and help you to purchase these things. It is all downloadable. Once you download this documentation of the information, so 21 hours of total evaluations and everything is there, and you can download it, read it, and feel it, pulse, and write a journaling and everything. That will help you a lot for understanding these things. Thank you very much. Now I will take questions. Looking to study the World Ayurvedic Wellness with a friend or two. Great, highly informative platform to knowledge. That's good. Everybody, please mute. That's good. Any other questions? If you have any questions, please write it here. I'll be happy to answer. Don't unmute yourself. And if you have any questions, I will be happy to answer for all your questions. We have 20 minutes time is there. We'll be happy to answer for all your questions. If you do not have any questions, I will be happy to invite you, Pandit Neil Parmeshwar ji, who is exponent in the Mantra Chikitsa, and he will be happy to recite some of the chantings and bless us with a wonderful way of a recitation. Neil ji?
Yeah, namaste, doctor. Hello.
Yes, you can bring yourself for the video on.
Yeah.
Yeah.
Namaste.
Namaste to everyone. And Pandit ji is here. And Pandit means scholar. A scholar of Vedic knowledge is any Pandit or Guru. You can call a Guru or Pandit or anybody. And Pandit is a scholarly person who is exponent of the knowledge of the things. And we are very, very fortunate to have him here in our Lehigh Valley area, in Central Valley area. Pandit Neil Sahil Parameshwar is an exponent in the Vedic knowledge and Vedic things like that. He will be happy to recite some of the recitation for us. And we are fortunate to start a wonderful program that is called Mantra Chikitsa. Mantra Chikitsa is a mantras means Vedic sounds. Mantras, a lot of people may not heard about this word. The mantra is Mriyate manyate iti mantra. Mantra means mantra gives a powerful knowledge like that, and it's a powerful way to learn these things. And there's a question is there before starting this thing. Lurs is asking question. After this course, will we be able to diagnose Vikriti and treat? Yes, when you know the Vikriti is imbalance of Prakriti and Vikriti, these are the two words are there. Prakriti and Vikriti. Vikriti is an imbalanced state. Vikriti is an imbalanced state when the doshas are in various levels are there. For example, in a Sanchaya Avastha is there, Sanchaya, Prakopa, Prasara, Sthana Samshaya, Vyakti, Bheda. These are the 6 stages of the manifestation of disease. Once they know about the things, then you know that what is the thing is going. For example, your Vata dosha is increased. You can give without any herbs, you can do it like that. Vata dosha qualities are when the dosha is increased like that, you feel dryness in the skin. You may need to do oil application. If you feel that dryness in the constipation issue is there, maybe you may need to take some Triphala. If you have a knowledge about the Ayurveda and everything, you may take a Triphala or some prune juice or some raisins, or maybe eating more salads, more things like that, which are the more fiber foods you are eating, then its constipation will be relieved. Or maybe incorporating more oily foods. Some flaxseed oil, ghee, and those type of things can be incorporated. So that is the way it works like that. How you apply the knowledge. How long does the whole course last? Very good question, Dr. Martin. Dr. Martin from Switzerland. He is one of the person who has invented this Shiro crystal mind. Crystal mind he invented. He is a psychiatrist, MD psychiatrist, and he studied Ayurveda. And the modern medicine he studied, and as well as he studied Ayurvedic medicine from Benares University. He's a very good friend of ours, and he's Switzerland. He always invites me to come to Switzerland. And he is asking this question like that, how does the whole course last? How long does the course? This course is segmented into the broadcasted in the past. We have recorded there. Each session is 3-hour session. So totally 7 sessions are there. You can download one time all 7 sessions. You can download to your computer. Once you download to your computer, then you can watch as many times. As many times you can watch. And there is also PDF files are there. You can also download the files also. Once your files are downloaded, then you can start practicing yourself like that. Then if you have any questions, you can contact us after downloading the information and everything. Like a few days back, one of the students registered and purchased this class, and then she asked that how I feel the Vata pulse is moving to Pitta. Yeah, that is clearly explained in the class session like that, how the Vata pulse is feeling like that. If you are feeling Vata pulse is moving to Pitta location, you put a tick mark. If you are feeling the Pitta pulse is moving to Vata location, you put a tick mark there. And then you need to understand that when the Pitta is going to Vata, what is going on in your physiology? A lot of times you can able to tell that what is going on in your physiology, how the reaction is there. A lot of times we do that, headache is there. Headache can be Vata or Pitta or Kapha. So if you are putting a lot of oil on the head, if your Kapha dosha is there, imbalance is there, then Ama condition is there, then it will aggravate the more condition, more problem. You need to know that whether it's a Kapha type of Vata the headache or Pitta dosha headache or Vata dosha headache. You need to know about that. Accordingly, you can work on that. So that is clearly explained in that term. Can we treat Prakriti? So we don't treat the Prakriti. Prakriti is innate quality. We are not changing. We are not making the monkey to donkey, donkey to monkey. We are not made anything like that. We are not making anything like that here. And what we are doing, Prakriti is the individual body innate quality. Prakriti is formed at the time of conception. When the mother and father conceived, at that time, Sukra Shon is Samyogat. It's clearly mentioned according to Sushruta, he's clearly mentioned that Atma also enters into that at the same time. So there's so many factors are influencing there at that time when the conception is taken place. That is the reason in India, it is a given highly respectable time is there when the unification of the male and female are joining together, auspicious nakshatras, auspicious time is taken, auspicious occasion is taken, and special pujas are performed, and that is called Shobhana Ratri. Shobhana Ratri means Shubharatri. Shubharatri means that is the people are joining together, male and female unification is taking. Shiva and Shakti joining together at the time. When the joining together, they have to be peaceful mind, relaxed mind. Otherwise, we'll have all the cuckoo mind people are there, mentally disturbed people are there. Then we have to refer all the people to the Dr. Martin.
I have a question, Shekhar.
Yes.
Is the pulse still readable for somebody who had an infarctus?
Infection?
Infarctus.
Infarct.
A heart attack.
Heart attack. Yes. As long as pulse is there, a person is alive, we can feel the pulse.
Yes, but it changes the pulse, doesn't it?
No, it changes the pulse, but you can see the pulsation also, various levels like that. When the infarct is happening, the body circulation is happening. Even some of the people who are taking medications also, it can changes like the pulse. It can tell clearly that it's not a natural phenomenon. It is naturally is not happening. Then we can detect it like that. Yes, there is an abnormality is happening in the level of a vata pulsation, pitta pulsation, kapha pulsation. We can tell also.
You can still make a full diagnosis.
Yes. Evaluation can be done.
Thank you very much.
Welcome. Prakriti is the individual's balanced constitution. That is true. That is 100% true, Elizabeth. So what is happening here when the Prakriti is formed in the body, and from there imbalances can come. Like for example, a person's vata constitution is there, but even though he gained with kapha qualities are there, but still his innate quality of vata qualities are not going away. Like you see the elephants. All elephants are kapha? No. Some are wild, some are angry, some are frustrated, some are quiet. Go and sit next to the elephant. Some elephant is quiet and relaxed, that's kapha quality. And when you go nearby and it will hit you, that is pitta. And some becomes shouting, that is vata. So this is the way it happens like that. Can we identify the pulse of cancers and tumors? Very good question. So we don't tell that people having cancers and tumors. What we can say that the deep-seated imbalances are happening in the physiology. We are not here to diagnose the conditions of the Western diagnosis. Like, do I have a thyroid problem, hypothyroid problem, or cancer diseases like that? We don't talk about that. What we do, we see the imbalances. What we are telling that if you see the imbalances are there, for example, you are behaving badly, what we do? We'll send it to the psychiatrist. You are arrogant, absolutely obnoxious, and all the behaviors are there, we'll send it to them. We don't need to send it to the cancer specialist. If you are having some deeper imbalances are there, if you have a doubt of it, then definitely it's go to the examination. Now, modern technology has developed such a way that the highest technology is there, ultra modern technology is there. That technology you are using, that doesn't mean that you are using Western medicine. Western medicine is different. The diagnosis technology is different. Like a physicist, chemistry guys, who has developed this technology? Like MRI technology is not invented by the doctors. It is not a Western medicine. Like an electricity, like an EKG machines, computers. We are using computers. Technology is there. Technology is different. The way of technology to evaluate the situation like that. If you feel that the kapha dominance is there, lethargy is there in the body and everything, and a feeling of more and more anxious and worried and everything qualities are there, there's a chances of getting of some issues of the hypoglycemic and the hypoglycemia conditions, and as well as hypercholesteremia conditions also there. If you see that type of symptoms are there, then you can go for the blood work. We recommend them to go to the blood work. So there it is very important to identify these things. Next, can we find Vikriti in somebody who is paralyzed from the stroke? Yes, certainly. If the circulation is there, if the body, I have seen several patients who are paralyzed, and hemiplegia, quadriplegia, those cases also we have seen. People whose hand pulsation is there, if the hands are very cold, and if the completely no circulation is there, what is happening? The necrosis will develop. The patient will develop the necrosis. The patient amputation has to be done. So people who are having circulation is there. We can definitely improve the circulation by adopting various panchakarma therapies, and various therapies can be done. And even the acupuncture needle therapies, those type of things also definitely helps the people who are having the paralysis, strokes like that. Any other questions? I'm seeing any questions here. No. Good. Any other questions you have? No. Good. Panditji, now I request you to, we have a 8 minutes time, and bless us everybody. And we are putting in a webinar on Mantra Chikitsa, free webinar. Please enroll into that. We will send an email to all of you on the 22nd of this month, of October 22nd at 4 p.m. Eastern Standard Time. We are doing a webinar on the Mantra Chikitsa, and we put together a wonderful program. Panditji is available, and he is going to bless us and giving a wonderful knowledge. Panditji, now your hands.
Om Namo Bhagavate Mahasudarshanaya Vasudevaya Dhanvantaraye Amrita Kalashahastaya Sarvaroga Nivaranaya Sarvabhaya Vinashanaya Trailokya Nidhaye Trailokya Padaye Shri Mahavishnu Swarupa Shri Dhanvantri Swarupa Shri 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 Aushadha Chakra Narayanaya Swaha Amritodbhavaya Vidmahe Amrita Devaya Dhimahi Tanno Dhanvantarih Prachodayat. Om Yaschanda Samrishabho Vishwarupah Chandobhyo Dhamrita Sambhabhova Samendro Medhaya Spranotu Amritasya Devadharano Bhuyasam Shariram Me Vicharshanam Jihva Me Madhumattama Karnabhyam Bhuri Vishravam Brahmanah Koshosi Medhaya Pihitah Shrutam Me Gopaya. Om Shanti Shanti Shanti. Hamsa Hamsaya Vidmahe Parama Hamsaya Dhimahi Tanno Hamsah Prachodayat. Mahadaive cha Vidmahe Vishnu Patni cha Dhimahi Tanno Lakshmi Prachodayat. Thank you, Doctor.
Thank you. Thank you very much, Panditji, for giving a blessing for all of us, and hope this information will be helpful for you. And we'll be sending an email to you also where to get a complete recording of our presentations and about the pulse technique, how to purchase yourself. You can buy it, and after listening to these lectures and everything, you will be learning of these things. But again, your practice is very important. If you are licensed to drive, but you never drive again and again, but you never be a perfect driver. Same thing. This is the technology is very important. You need to practice it. Once you practice it, it takes time. For that, you need to have a crystal mind, of clear mind, good healthy eating habits. Wake up in the early morning, eat less junk food, and be thoughtful and mindful, and less non-violence foods like that, particularly animal proteins, animal foods like that can be reduced. And non-violence, you can maintain it. You all influence on your health, and meditation is important. We are also going to teach you some of the meditation techniques, also online meditation techniques. And Dr. Martin is expert in that. We have a wonderful book. He's written by Inner Silence. He has written a wonderful book. It's a very simple book. You can look into the book, Meditation by Dr. Martin. Bertrand Martin. He has written a wonderful book, simple book, easy practice like that. That can be, you can see that that meditation technique also. These are all these things are well helpful for you. And you can see Dr. Martin is a more learning, layered palpation, and being able to sense deeply the changes in the comparison of the normal. It is less like about the wave form like we see on the catheterization. Hope that helps. Thank you. Thank you, Raj. Thank you one and all. Namaste to all, and we'll sending you information to you. And please look into the information on the website, and everything is there. All the informations you are carrying on that. Don't unsubscribe for our emails, and you will be getting a lot of wonderful information. A lot of goodies are coming in the email box. Thank you very much, one and all. And join in the must to join in the Mantra Chikitsa certification program. We have various levels of programs are there. Next week, we are teaching about the Marma course, free Marma course online class. Okay, free webinar. Thank you very much. Happy Navaratri to everybody. Thank you.
Still waiting for your visit to Switzerland, Shekhar.
Yes, I am planning. Once the
Okay,
corona stops, then I will come.
good. When will it stop?
I am asking Panditji. Whenever it stops, then I will come.
Okay.
Yeah, recently one of my friend, he came to Croatia, and now when he came back, and he is in a quarantine for 14 days. So I don't want to go into quarantine, even though the testing is reliability and everything is there, vaccination, everything is there, but still we have to be very careful what we are traveling. You may be
Yes.
careful, not other people are not careful.
Are you vaccinated?
Yes,
Yes. With what?
Johnson.
Ah, okay. It's a standard normal vaccine, no?
Yes. We'll talk about that also. Thank you very much, all of you. Namaste.
Thank you.
Thank you.